think number one, especially for such our front line for our cancer patients, oncology nurses are so incredibly important because they are the point of contact. They're the people that our patients are seeing over and over again. So I think the first thing that I would highlight is truly that you cannot tell as someone is walking through the door whether or not that they're experiencing financial toxicity. In a prior study that I had done, a qualitative study in breast cancer, I mean, we had college educated women who were making six figures, who, were married and had a job, but just because of financial circumstances or where they lived or elder care, other responsibilities, were experiencing incredibly significant financial toxicity. So I think the first thing that I would like to highlight just to our frontline workers, to our oncology nurses, is that you just can't tell based on your own impression or risk factors who's going to walk in the door and who is going to be struggling financially. I think what we've learned from other studies that will hopefully be coming out is that when you actually ask patients who they want to be asking them about their finances and how often they want to be asked, it turns out patients actually do want to be asked early and often and want to be asked repeatedly if they're doing okay, if things are going well financially. So that really puts our oncology workforce and especially our oncology nurses right at that front line of being able to be that type of screener or being able to realize that someone's struggling and potentially connect them with resources. While we haven't quite yet 100% validated, a great screening item, our group and others have been using the cost question 12 from the facet measure, which is some version of my illness is a financial burden to my family and I. We are doing some work that was recently accepted as an abstract that is trying to show correlation of that one item with the broader financial toxicity measure. So there certainly are short single item screening things that you can use, such as, my illness is a financial burden. Some people have been using some medication based stuff, such as, do you have trouble paying for your medications or do you have to skip medications? So there certainly are sort of short form screening items that are out there. And there are some institutions or some, cancer centers that have formally instituted some sort of screening measure to be able to ask patients. So I think our oncology nurses absolutely are the front line, are there seeing our patients, are in front of them, are their point of contact, and represent a wonderful group of people to start asking these types of questions and or to be getting them through the electronic medical record and be able to flag, hey, I'm worried about this patient. I think that they could be connected with some resources. One key point for me is probably that, when I think about financial toxicity, I feel like when I first started studying it, I was really thinking about dollars and cents and what's the bill in the mail that you're going to get? Like, what is the actual money that you're paying? But I think it's really important to remember, and we don't always realize this, is how much indirect cost there is. So let's say, for example, you have a young mom who provides a lot of childcare, who's having to come in for all these repeated appointments. And well, now they need childcare and they need to pay somebody to come in and watch their kids so that they can go to cancer treatment. Or if you think about gas and parking, and I'm a radiation oncologist, I'm constantly telling my patients to buy Aquaphor, to buy other skin creams, all these other costs that come into play outside of costs or, hey, here's the bill that you got in your pocket. The second thing that really kind of strikes me is that when we're talking about financial toxicity, we're actually talking about two components. One is, yes, that objective stuff that I just talked about, bills, how much you had to pay for gas. But remember that financial toxicity is really this subjective experience. It's the stress and the way you're changing your behavior and the anxiety from every time you open a piece of mail because you're worried about what is going to show in there. There is this whole subjective component. And so you could take two people who might have the exact same income exact same objective costs, so bill in the mail, but based on their coping mechanisms or maybe their family support or just inherent sort of ability to deal with stress, could have two very different experiences of financial toxicity. So when I'm thinking about tying patients into resources, yes, I'm also thinking about, hey, are there charities, or can we get you a food voucher, or can we get you a parking voucher? Yes. But it's also about getting that other psychosocial support as well. Hey, you're going through an incredibly stressful time in your life. How can we make sure that you have the resources that you need? And sometimes for some patients, it might just be people like their oncology nurses or people that they come to trust and develop a really good relationship with, where even that relationship and that friendly face and someone that you see regularly for your appointments and talk to on the phone can actually help alleviate some of that stress and therefore lower financial toxicity just by becoming a trusted member of the care team.